discuss this. Sulfur containing amino acid, they are two in number. One is cysteine, second is methionine. Again, I would remember the structure. Suppose this is CH3. This is alanine. If I remove this H or add just OH, this is serine. Again I repeat, this is alanine, this is serine, and if I say this is SH, CH2SH, this is cysteine. Okay, so cysteine is having SH. So alanine, you know, alanine, oxygen is joined, serine, sulfur is joined, cysteine. Clear? Now CH2 SCH3, this is methionine. You can't afford to forget this structure. CH2 sulfur CH3, this is methionine. So methionine cysteine, we found that out of methionine and cysteine, yes, methionine is large thing you can't synthesize, we make a mnemonic. Large cheese you can't synthesize, large thing you can't synthesize, so this is essential. Yes, if you count the number of letter cysteine and methionine, you will find methionine is having more number letter, so methionine essential, cysteine non-essential. I will explain also for the time being. Yes, in the same way, in out of these three, if I say one is essential, by the name, I don't say you to remember the structure. Yes, just remember the name and count the number of letter and tell me which one is essential. Which one is essential? Yes, if you count the number of letters out of these three, threonine is having maximum number of letters. Yes, threonine is essential. Yes, threonine is essential. So in the same way, methionine is essential. Clear? Now, we found that this is methionine. Very good. Methionine, this is methionine. So these are mnemonic. Yes, in the last you will find that when questions are asked, many times what we do remember all the mnemonics and we try to remember all the symptoms, all the characteristics of each and every amino acid, and we make so many mnemonics. I say no. Most of time you will find question that which is essential, they give cysteine, methionine common, and they ask, yes, you can easily find, okay, methionine so many letters, cysteine and methionine, you can easily exclude cysteine and you will mark methionine. In the same way, in these three you can easily remember, okay, threonine. In these five you can easily remember essential to live. Okay, so you can. And if polar, non-polar, I told you all these are non-polar except glycine, which is considered both polar and non-polar depending on the question. In this I told you all amino acid which are having OH, they are polar. All amino acid are polar. All amino acids are polar except tyrosine. Yes, I draw the structure of tyrosine here. Yes, although I will discuss in detail, but for the time being, NH2C, COOH, H, and if I make this aromatic ring and OH, this is tyrosine. This is tyrosine. So this is having this aromatic ring. This is having this hydroxyl group. Due to aromatic ring, it make hydrophobic interaction. Hydrophobic interaction. Due to OH, it has hydrophilic property. So you can say tyrosine has both property of hydrophobic and hydrophilic. That's why many times we say this, sometimes we consider tyrosine as polar, sometimes we consider tyrosine as non-polar. Okay, depending on the question, you will consider it polar or non-polar because it is having both a polar property and non-polar property. Clear? Clear? So for the time being, even if you forget the structure of this tyrosine, I am comfortable. You should be comfortable. Yes. Are you retaining this? I know this structure is little bit, difficult to retain, but if you will do once or twice, you will be able to retain it and you will be able to solve complicated questions very easily without wasting time, without any mnemonic. Okay. Yes. So I say, yes, this is SH. This is CH2SH. And you can easily remember alanine. If you add O, OH, serine. If you S, SH, cysteine. So cysteine, serine, alanine are quite similar, only H, OH, SH. Okay. And yes, all these are non-essential, and all these are non-essential, and I told you glycine and serine, the only difference was methyl group and OH group. If I remove methyl group and OH group, then it would become glycine. So serine can be converted to glycine by hydroxymethyl transferase, and this reaction produce methylene tetrahydrofolate, and this is primary donor of one carbon atom. Okay, clear? Now, yes, this is methionine. Again, I repeat, this question was asked recently in INISAT. So either you mug up this reaction, difficult reaction, or you understand. It's your own choice. Let me discuss. This is very, very important. Yes, I draw one more structure, amino acid H CH. This portion is common to each and every amino acid. CH2 CH2 SH. So yes, I draw it again. Yes, CH2 CH2 SH. Okay, so you can say that this portion is common, this portion is common, this portion is common, this is common. You can say sulfur. The only difference between these two structures is methyl group, and I say this is homocysteine. This is homocysteine. So what is the difference between methionine and homocysteine? This is methionine, this is methionine, this is methionine, and this is homocysteine. The only difference is methyl group. If I remove this methyl group, it is converted to homocysteine, or if I join methyl group to homocysteine, it will become methionine. So yes, what we did, yes, methionine is normally converted to homocysteine. In our body, methionine is normally converted to homocysteine, but we found, yes, when you will write like this, when there is increase homocysteine, yes, increase homocysteine, very good, Amal. When there is increased cysteine, at that time, this homocysteine can be converted to can be converted to, or is converted to, better to say, is converted to methionine by enzyme by homocysteine methyl transferase. Means if I transfer methyl group to homocysteine, it will be converted to methionine. So in our body, we found that whenever homocysteine increases, this extra homocysteine is converted to methionine by which enzyme? Homocysteine methyl transferase. And in this homocysteine methyl transferase, methyl group donor is folic acid. I told you, primary donor, yes, of one carbon group is folic acid. Yes, folic acid means methylene tetrahydrofolate. Yes, and we found that in this reaction there is B12 is used as cofactor. So you can say this reaction require both B12 and folic acid. And if B12 and folic acid is there, then yes, B12 and folic acid is there, then homocysteine can be converted to methionine by enzyme homocysteine methyl transferase. So normally in our body, whenever homocysteine increases, it is converted back to methionine by homocysteine methyl transferase. So now tell me, I told you the definition, anything which can be synthesized in our body is non-essential, which can't be synthesized is essential. So methionine is essential or non-essential? Methionine is essential or non-essential? Yes. I explained here, I made you remember that methionine is essential. But now I am taking U-turn just like a politician. I am taking U-turn just like a politician. Yes. Yes. Yes, it's not a... Yes, Srivalli told the correct answer. Yes, it is hidden. Yes, when there is increased homocysteine, means this is homocysteine methyl transferase has low affinity, high Km, low affinity for homocysteine. Just like glucokinase was having low affinity for glucose, in the same way homocysteine methyl transferase has low affinity for homocysteine. It will convert homocysteine to methionine only when blood homocysteine is high, not normally. So it should be normally, methionine should be normally come in diet. But if in our body more and more homocysteine is accumulated, this extra homocysteine will be converted back to methionine by homocysteine methyl transferase. Why I am telling you like this? Because when questions are asked, they start like this, that in our body there is enzyme homocysteine methyl transferase which require folic acid B12 as cofactor, and in the presence of B12 and folic acid, this homocysteine can be converted to methionine. Yes, we found so many studies in which we found that methionine is option A essential, option B non-essential. And when they give this reaction, we think that this is synthesized in our body, this should be non-essential. But no, this is essential. Got the point? So means why body has this protective mechanism, why nature kept this homocysteine methyl transferase, because we know homocysteinemia, homo if this yes homocysteinemia, homocysteinemia is associated with increased risk of cardiovascular disease, increased risk of cardiovascular disease. We found that homocysteinemia is associated with increased LDL, associated with increase LDL. Yes, why I have use the word associated, because we found that whenever patient is having homocysteinemia, it predisposed to increase LDL level, it has some association. Okay, so cardiovascular disease. And beyond this topic, you must know, yes, a question is asked that, yes, I do remember this was favorite question even now. Yes, you may put in box here. Marfan syndrome, yes, homocysteinemia, yes, dislocation of lens, Marfan syndrome, dislocation of lens, yes, in Marfan syndrome, do you have any idea? Yes, dislocation of lens, yes, dislocation of lens in Marfan syndrome. Yes, upwards, very good Ravi, and outwards. Homocysteinemia downwards and inwards. Yes, upward means superior, outwards mean temporal, downwards means inferior, inwards mean nasal. Yes, very good, very good. So I do, yes, you remember, but I used to make mnemonic Marfan syndrome fan. Fan is present upward. So I do remember in 2003-4, yes, when I was preparing for PG entrance exam, yes, then at that time they used to ask question Marfan syndrome, dislocation of lens upward. I made mnemonic fan. But later on they started making answer question upward and outward. Then I said, okay, don't worry, I will remember that this is second time. I remembered the fan of split AC. Yes, fan of split AC. Split AC fan is upward and outwards. Okay, so I changed the mnemonic, but yes, you must, yes, although you have remembered this in your own way, but sometimes we forget. Hamos upward and outward, fan of split AC, upward and outward. Okay, clear? So this is homocysteinemia. Yes, so that's why we have protective mechanism that homocysteine are converted to methionine deficiency, folic acid and B12. Yes, we found that in folic acid B12 deficiency, there is megaloblastic anemia, megaloblastic anemia. In B12 deficiency, there is megaloblastic anemia. Yes, in folic acid deficiency, B12 deficiency, megaloblastic anemia, both deficiency may lead to, yes, homocysteinemia. homocysteinemia. Yes, so we found that megaloblastic anemia, homocysteinemia, both may present in both folic acid deficiency and B12 deficiency. You will find many times in clinical practice what happens. A patient came to me with megaloblastic anemia. I immediately start folic acid. Many times clinicians start folic acid without thinking about B12. Okay, means suppose in this patient megaloblastic anemia, yes, 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 suppose this is megaloblastic anemia, yes, yes, megaloblastic anemia and homocysteinemia is there. Yes, megaloblastic anemia and homocysteinemia is there. We, yes, we will, yes, we many times give only folic acid, but suppose this patient is having B12 deficiency and we found that these patient may respond slightly, not completely. These means patient may yes, may respond in megaloblastic anemia symptoms by folic acid. Again I repeat, patient is having B12 deficiency and you started folic acid, patient is a little bit improving in symptoms of megaloblastic anemia, but B12 is deficient, and you know B12 deficiency can lead to many neurological manifestation. This patient will worsen superficially. You will think the patient is improving, but you are deteriorating the patient. So how you will differentiate? Suppose a patient came to me having megaloblastic anemia, homocysteinemia. Yes, I will check methyl malonyl coenzyme A. Methyl malonyl coenzyme A. We know that methyl malonyl coenzyme A in our body is converted to succinyl coenzyme A. If I ask you, methyl is having one carbon, malonyl is having how many carbon? Please do reply. Succinyl coenzyme is having how many carbon? Succinyl coenzyme is having 4 carbon. So this is 1 carbon, this is 3 carbon. So I can say yes, 3 plus 1 4. This methyl malonyl coenzyme A can easily convert it to succinyl coenzyme A, because these 1 carbon, 3 carbon, this is 4 carbon. So this is mutase. The name of enzyme is methyl malonyl coenzyme A mutase. Mutase. And this mutase require B12 as cofactor. Very good. B12 as cofactor. If B12 is deficient, then methyl malonyl will increase and there will be methyl malonyl aciduria. Methyl malonyl aciduria. So you will remember, they will give question in which they will give question in which they will give megaloblastic anemia, they will give megaloblastic anemia, homocysteinemia, and they will give methyl malonyl aciduria. The cause is B12. The cause is B12. If they don't give methyl malonyl aciduria, then it is the chance of folic acid. So they ask you to differentiate between B12 deficiency and folic acid deficiency on the basis of this reaction, methyl malonyl coenzyme to succinyl coenzyme A by enzyme mutase. That's why I say, if you remember number of carbon, you will be able to remember many reactions and many enzymes only by the concept. Okay, now if I say this enzyme is deficient or this folic acid is deficient, B12 is deficient, then yes, homocysteine will not be converted to methionine, homocysteine will increase, and this is called non-classical homocysteinemia. This is called non-classical. So this part, whatever I have this discussed, this homocysteinemia is non-classical. Non-classical. Yes, this, yes, you can say this deficiency led to non-classical homocysteinemia. What is classical homocysteinemia? Let me explain. Yes. So have you understood this part? Yes. This was, let me repeat fast. Normally in our body, when homocysteine increases, this extra homocysteine is converted to methionine by homocysteine methyl transferase, because we know the only difference between homocysteine and methionine is methyl group, and this homocysteine methyl transferase require folic acid and B12. If any one of these is deficient, then you will not be able to convert extra homocysteine to methionine. Homocysteinemia may be there. This is called non-classical homocysteinemia. This homocysteinemia increase risk of cardiovascular disease associated with increased LDL. And you all know homocysteinemia, the dislocation of lens, downturn inwards, Marfan syndrome upward and outward. Marfan is fan of split AC. Yes, we found that folic acid deficiency, B12 deficiency, both can lead to homocysteinemia, both can lead to megaloblastic anemia. We found B12 has important role in the conversion of methylmalonyl coenzyme to succinyl coenzyme. Why the enzyme mutates? If B12 is deficient, methylmalonyl aciduria would be there. So you can differentiate B12 deficiency and folic acid deficiency by methylmalonyl aciduria. Yes, and now we come to the next part. This normally in our body, methionine is converted to homocysteine. Yes, you know the structure of homocysteine. I draw the structure of serine here. Yes, react with serine. Okay, I know space is less, but you can write. Yes, NH2 C COOH H. This portion is common to each and every amino acid. CH2OH. So I joined homocysteine with serine, and when we join homocysteine with serine, it becomes cystathionine, and the name of enzyme is cystathionine beta synthase. And this cystathionine beta synthase require vitamin B6, and cystathionine is produced. What is cystathionine? What is the structure of cystathionine? I say, even if you don't remember, you can afford, but if you will have an idea about the structure of serine, you know structure of serine, you know the structure of homocysteine, they join to form cystathionine. Cystathionine is converted to cysteine, Yes, means, if look at the screen, if I transfer this sulfur to serine, and this oxygen is given to homocysteine, means they join together, serine and homocysteine join together. Homocysteine says to serine, take my sulfur. Serine said, yes, I like sulfur, my name is S, I will like S. So serine took sulfur, and now it takes sulfur. When it takes sulfur, it would become, yes, when they join, they exchange, yes, sulfur and oxygen. This is NH2 COOH H CH2 SH. What is homoserine? Yes, NH2 COOH H CH2 OH. Yes. So what happened in this reaction, you can easily tell me now. Yes, homocysteine and serine reacted, they exchanged their sulfur and oxygen. Homocysteine become homoserine and serine becomes cysteine. So you can say, in this way, in our body, normally in our body, again I repeat, normally in our body, that methionine is converted to cysteine. Methionine is converted to cysteine, and the name of enzyme is cystathionine beta synthase, cofactor is B6, and if this is deficient, B6 is deficient, or this enzyme is not working, then it is classical homocysteinemia. And question recently asked that in classical homocysteinemia this cysteine will not be synthesized. Normally in our body, methionine is converted to cysteine by multiple steps. Normally in our body, methionine is essential and it is converted to cysteine by multiple steps. But if this cystathionine beta synthase is not working, then methionine will not be converted to cysteine. Cysteine will not be synthesized in our body, and if cysteine is not synthesized in our body, it becomes essential. So cysteine becomes essential. Yes, cysteine becomes essential in classical homocysteinemia, and they ask question indirectly in this time that in B6 deficiency, cystathionine beta synthase activity is not there, classical homocysteinemia is there, which compound you will give in the diet? The answer was cysteine. Yes, answer was cysteine. Okay. So you know that folic acid is an important methyl group donor, but other than homocysteine, we found that other than folic acid, what I said, okay, folic acid is very important methyl group donor. We found that other than folic acid, there is the word you must have heard many times, SAM, S-adenosyl methionine, S-adenosyl methionine. S-adenosyl methionine, SAM, is a very important methyl group donor in our body. Yes, important methyl group donor. So for the time being, just remember, suppose this is adenosyl group. Yes, if you don't remember the exact structure, that's why I make a circular thing. This adenosyl group interact with sulfur, means S sulfur is attached with adenosyl group. I can say this is methionine, this is methionine. Yes, you all know this is methionine. In this methionine, this sulfur interact with adenosyl group. This adenosyl group, when it interact, this methyl becomes unstable. That is S-adenosyl methionine. This methyl become unstable, and this can give this methyl group. That's why S-adenosyl methionine is important methyl group donor. Even if you don't remember this, I am comfortable, you are comfortable. Just told you that this is the concept. Yes, that S-adenosyl methionine is this. Before solving this question, I would like to give you the real concept. What is the real concept? You must know. Yes, don't turn pages. Yes, I will discuss it in detail, because 3 questions from these structures indirectly recently in INICET. Look at the screen. Yes, in this, if I ask you, this is uracil, this is thymine, in these structure, the only and only difference, this portion is common, this portion is common, this portion is common, this portion is common. The only difference is methyl group, and methyl group donor is folic acid. Methyl group donor is folic acid. So uracil can be converted to thymine by methyl group giving methyl group. So folic acid is methyl group donor. Folic acid is methyl group donor. So we found that this folic acid give methyl group to this uracil to become thymine. So suppose you have 1 molecule of folic acid. Even if you forget, it's okay. I say forget about that. Just remember, I have idea. Yes, folic acid is required in some genetic reaction. And I know that, yes, I know that folic acid is also required here. If you have only 1 molecule of folic acid, you will prefer which reaction, or body will prefer to utilize this folic acid methyl group in this reaction or genetic reaction? Please do tell. If you have less folic acid, definitely our body will try to use folic acid for more vital thing, means conversion of uracil to thymine. Okay, yes, genetic. So that's why a cardiovascular researcher is conducting a study to evaluate the relationship between folate level and cardiovascular disease. Yes, the result of a study show that persons with lower folate level have twice the risk of cardiovascular disease mortality than do those with higher folate level. Because if a person is having low folate level, then genetic thing would be preferred, and then homocysteine will not be converted to methionine. Okay, so if folic acid is low in our body, then genetic will not be affected, but better to affect this part, and this will lead to homocysteinemia, and homocysteinemia increased risk of cardiovascular disease. And you know which enzyme would be affected. Yes, which enzyme, yes, which of the following enzyme is most closely related to the role of folate in lowering the risk of cardiovascular disease? The enzyme is homocysteine methyl transferase.